Hi, guys. Welcome to another episode of Modern Health with Dr. Jane. Of course, I'm Dr. Jane. I'm a naturopathic doctor and natural fertility expert, and I help couples who have been struggling with infertility for over a year get to the root cause of their infertility struggles so they can conceive naturally. So I get a lot of questions around labs. What labs do I need to run? What's the optimal range versus the normal range? And a lot of frustrations around labs like, hey, all my labs came back normal. Or I don't actually know what these labs mean and nobody is explaining it to them. And they only run it when you're struggling. So, what about if I am trying to prevent the struggle? Can I do something about it? I want to record this podcast episode because I really want you guys to avoid some of these mistakes that my couples have made. A major one being that we can't even get lab work done until you've been struggling to conceive for over a year, which makes absolutely no sense, especially if you want to have a healthy pregnancy and a healthy baby. So the mistakes that I see my couples make is they don't actually take a copy of their lab work at all. So they have no idea if the labs are in fact normal, and they don't actually know what the results mean. And you kind of put your trust in this doctor that you see once a year for 10 minutes, that they're going to review your lab work and tell you if something is wrong. And so the other thing is we're almost subconsciously don't want the doctor to call us because you're worried about bad news. And so you just hope that they don't call you. But in reality, you still don't have any answers. You don't have an explanation. And, if everything came back normal, you don't do any further investigation. You're just like, I guess everything is normal, but I still can't sleep. I'm bloated. My menstrual cycle is all over the place and I can't get pregnant. We have to realize that the healthcare system has changed a lot. And we have to realize who is it that we're putting trust into. Essentially, I want you to make sure that you grab a copy of all of your lab work and you have it, because even though you are not going to understand the results and you're not going to be able to interpret them all, you still want to be able to look at the lab work and see if there's anything that says, L for low or H for high, just to see if it's out of range, right? Because a lot of my patients, even like whether it's a sperm analysis or blood work or whatever, they're like, no, my doctor didn't say anything about this. And I'm like, well, there's clearly bolded things on here that are red that we know are not normal. And so if you ask for a copy of it, you would at least be able to go to your doctor and say, okay, but what does this mean? I see that this is low. What does that mean? Is there anything I can do about it? So we really want to make sure we get an explanation with all the labs, what it means. Is this an optimal range versus a normal range? And then you want to do like deeper digging if it's necessary. Don't make the mistake of, well, I guess everything is normal, assuming that everything was tested. It's literally impossible to test everything now. So I'm going to tell you that there's a difference between labs. Okay. There is diagnostic labs and then there's functional labs. And your diagnostic labs are literally things that are looking for a diagnosis. So whether it's looking for a diagnosis like PCOS or endometriosis or an autoimmune disease, hypothyroidism, we are literally looking for lab work to give us a diagnosis. So whether that's your blood work, ultrasounds, x-rays can be diagnostics, obviously, like MRI, CT scans. But a lot of the times, if you are quote unquote healthy and you try to take care of yourself, you're hoping to avoid the diagnosis. Like, you don't want the diagnosis of diabetes or PCOS or autoimmune disease. You're trying to avoid that. So blood work is a really great way, or any lab work, I should say, is a really great way to check into your system to see if in fact there is something wrong that you need to assess. And this is where the functional lab work really comes into place. And functional lab work literally tells us about the function of your body, what is going on in your body versus it's trying to diagnose you. So functional lab work, think about things like micronutrients. So what levels of nutrients do you have in the blood? Things like gut stool analysis to check the function of the gut, environmental toxins, organic acids. How are you metabolizing? How are you breaking down? How are your enzymes working? What about things like food sensitivities, right? Or even Lyme and co-infection panels. There's so many tests that have come out over the last, I would say, 5 years. It's really exploding, and you don't have to run all of them. right? You don't have to run all of them, but there are some that are going to be really, really beneficial, because remember, what is the point of running lab work? Well, the point of running lab work is to get an inside look into what's going on with your body. And if you're hoping to prevent disease, then you want to look at, how is the system doing? How's it managing? What's my liver function, kidney function, blood sugar regulation, hormones, right? Estrogen, progesterone, testosterone, to make sure that we don't actually ever need medication. And so I think the kind of the broken aspect of what has been happening is your conventional doctors looking for a diagnosis because they're looking to give you a prescription of some sort, while you are going with the intentions of avoiding a prescription at all costs, and you just want to get lab work done to check in on things. And so there's this kind of disconnect between why your practitioner is running lab work versus why you want the lab work run. And the last thing that I'll say is, like, your labs are only as good as your interpreter. So if you don't have a good interpreter, then you're just running lab work. Then you don't really know what it means. And that's why I say you always want to get an explanation. You want to have a practitioner who's going to explain these things to you. And that's why you want to get a copy of the lab work, so you could at least see if there is in fact any highs or lows. And I'll teach you a little trick about understanding if it's optimal versus normal range. So lab work really just provides us data, right? Data and direction. So we're not shooting in the dark. We can get really specific with the target. Usually lab work on its own is not enough. You also need to collect some data, because we need some context, meaning what's your diet like? What are you exercising? What's your sleep like? Stress levels like? Digestion like? Hydration, all that kind of stuff. And then you also need an assessment. So like, what are the symptoms that you have that you are experiencing on a regular basis that are bothering you, so you can connect the dots? Because if you just have data, aka like the lab information and the data, and then the symptoms separately, it's not enough. But when you're putting it together, it's almost like now you have deeper knowledge and understanding that context of what could be related to what. And then we can use that to really help guide the protocols instead of just shooting in the dark and get really, really specific. So the last thing that I already mentioned is, of course, you have to make sure that it should be the same person that's doing all those things, the same person that's analyzing your data, the same person that's analyzing your lab work and your health assessment, in order to provide you with an appropriate interpretation. It's hard to get an interpretation if you are running lab work with one person, someone else is doing a health assessment, and then you're trying to track data. And that's, again, kind of the mistake that I see with my couples, is you're trying to piece the information together. And I think there's a time and place to do that. If you don't have any major red flags going on, or you haven't been struggling to conceive for a long time, and you're just kind of wanting to learn a little bit more about your system and what's going on, then that's a perfect time to do that, is to collect some blood work, is to start tracking some data, to start, this is what I do in my Fertility 101 program, is like, hey, let's identify some points of focus instead of you just taking random advice from the internet and hope it's going to work. Instead, we want to see what is it that you actually need to focus on. So if you are struggling with issues, though, if you have been struggling with infertility, if you have, whether it's painful periods or PCOS or endometriosis or autoimmune conditions, you're past the point of you trying to figure it out, essentially like trying to piece things together. This is where I think working with a practitioner can be really, really powerful to help you bypass some of the common mistakes, if you will, and so save you time and get you feeling better right away. So you want to have somebody who's going to interpret the results for you. Like I said, your labs are only as good as the interpreters. And if you have to beg your doctor to run lab work, chances are they probably don't care. And so they're not going to be very helpful. So the thing that I want to go over with you guys today, and the most common questions that I get, is around sex hormones. So when do I test my hormones, ladies, and what are the optimal ranges? What are all the things that I should be tested? Because again, most of my couples say everything was tested and very few things have been tested. So let's talk about day 3, and it absolutely matters on which day of the cycle you measure your hormones, because ladies, we have a menstrual cycle, and that means we have fluctuating hormones. So in order to get a good assessment or a proper assessment, you need to test it at specific times of your cycle. Now, this isn't going to work if you're on birth control. Obviously, this is for your regular cycle, because birth control is it's a synthetic hormone. So it's going to shut down your own hormone production. So you're not going to get good representation of anything when you are on birth control. So let's talk about day 3. Day 3, the big things that I like to test is FSH, LH, and estrogen. Now, I also test testosterone, and I might as well get it done on day 3 because you're already getting blood work done. The only thing that I do post-ovulation, which is around day 21, but it's really 7 days post-ovulation, so you need to hone in on when you're ovulating, is progesterone. So what are we looking for day 3 in terms of LH and FSH? Day 3, FSH numbers anywhere between 3 to 10 I use per liter. And day 3 LH is about 2 to 7. That's the optimal range. Now, you want your FSH to be under 10. That's how we know you're ovulating and the communication between the brain and the ovaries is good. The higher the FSH, the worse the communication between the brain and the ovaries. And this is what we're going to see in premature ovarian failure, right? Because we see high FSH in menopause, in perimenopause. And I look at it as FSH is essentially like a parent-child relationship between the ovaries and the brain. And the higher the FSH, the louder the brain has to yell at the ovaries to ovulate. So we don't want that. We don't want the brain to be yelling at the ovaries. We just want it to be a gentle whisper and that ovulation to happen. Now, if LH is getting much higher than 10, and again, the LH and FSH ratio should be about 1 to 1, maybe 1 to 2 at the very most. The higher that ratio is, the higher the likelihood you have PCOS. And essentially that LH, the higher it is, it's like the brain is constantly trying to tell the body to ovulate. And sometimes we get 2 peaks of LH with PCOS and sometimes none at all in the cycle. And so the LH, if both of them are elevated, it could also be a sign of premature ovarian failure or poor quality of the eggs. Or like I said, if it's just the ratio that's off, that could be signs of PCOS. And now the most common thing that happens with PCOS is we're not ovulating every cycle. It doesn't mean that you don't ovulate at all, but usually you're not ovulating every cycle. And there's kind of this backlog that happens because instead of all the energy going towards one follicle and maturing that one follicle per cycle, it's like the energy is being distributed among all of the follicles. And so the body doesn't have this point of focus, if you will. And then it just causes a lot of issues, of course, with that high testosterone being in place and the insulin usually is disrupted. So then we're going to have low progesterone because chances are you're not ovulating or you're not ovulating regularly. So that's day 3. You want to do FSH, LH, and those are the numbers. Now you want to look at estrogen as well on day 3. And that's essentially when your hormones are going to be really, really low. So on day 3, it's 35 to 55 kilograms per mil. So PG dash per milliliter. Those are US ranges. It's really important that estrogen is not too low or too high. It's all going to be about balance. Really low estrogen, you're going to feel really tired. Estrogen is our like anabolic hormone that helps us build muscle, that gives us energy, right? That's the one that is really high during ovulation. And usually we feel really confident around ovulation. We feel good. So we want good levels of estrogen, but we want to keep them under control. The other thing that I like to test, like I said, is testosterone. And testosterone is really important for quality of the egg. It's obviously important for our libido, motivation, muscle mass, metabolism. So you're looking for free testosterone, you're looking for bioavailable testosterone, total testosterone, sex hormone binding globulin, and DHEA. So that is a proper assessment of your testosterone levels instead of just free testosterone or just bioavailable testosterone or just total testosterone. And what I'll say here is you want to be in the mid range. You don't want to be on the bottom half of the range. You don't want to be on the top half of the range. You really want to be in the middle of the range, and that's going to be your optimal number. If you're on the bottom half versus top half, now we're trying to look and see why. So if it's your total testosterone, that's in good range, but the bioavailable or like the free testosterone is low, then we want to look at that sex hormone binding globulin because that sex hormone binding globulin is going to bind testosterone. So it's not available for you to use. And of course, that's going to be a problem and for egg quality, like I said. But then the question is, why is that sex hormone binding globulin so high? And in my practice, I see a lot of it due to poor digestive function, poor detoxification. We're not getting, there is a dysbiosis that's causing the sex hormone binding globulin to be elevated, and then it's screwing up your testosterone. So we want to get ahead of that. And then DHEA is a precursor, right, to testosterone, to estrogen. So we want to take a look at it and make sure that you actually have enough precursors for what you need. And like I said, you want to be in this middle range for those things. The next thing, the last, so that's all day 3. I just get it done on day 3. I typically like to get it done also with all the liver enzymes, the cholesterol, the blood sugar regulation, everything on day 3. And then just day 21, I'll do progesterone and sometimes progesterone and estrogen, just to make sure that that estrogen is in control and not out of control in relation, especially to progesterone. And the last thing that I'll say about hormones on day 3 testing. So testosterone needs to be tested between 7 to 10 in the morning. That's really important. And I like to do the panels fasted. The reason I do them fasted, meaning you haven't eaten for 10 to 12 hours. So first thing in the morning, just water, no electrolytes, no caffeine, is because I'm running a bunch of other lab work that's associated with it. And I also think that the more variables we can take out, the better representation we can get when we're rechecking these things. So if you're constantly, like I ate this, or maybe I didn't eat, or I think I had coffee, I don't remember what I had, versus like every time you went in for blood work, it was around the same time, you didn't have anything to eat, then we've decreased a lot of those variables. So I really like doing that. I think that's a good pearl if you feel like you have no idea when you're testing for what. And then so the last thing that I do is day 21, but really for some it's day 19 to day 24, and sometimes it's even later. So if you ovulate later, depending on when you ovulate, it's going to be 7 days post-ovulation. So I had a call yesterday with a patient. It's like, I think I'm not ovulating, or it's late, and it's day 20 and I'm trying to make it to day 14. It's like, there's nothing wrong with you ovulating on day 20. But the problem is if you're ovulating on day 20 and you get your period 3 days later, then that's a problem because you have a short luteal phase. And that short luteal phase is obviously it's an indication usually of poor egg quality. And of course, we're going to have a hard time maintaining a pregnancy because there's just not enough progesterone. So really understanding and learning the signs of your ovulation. And I have a really great podcast on that, Ovulation 101, and how stress impacts ovulation, just so you can start to learn and understand your body and what it's telling you. Then we want to test that progesterone levels. And ideally, it's going to be anywhere between 15 to 25 nanograms per mil. So that's again in the US range. It's really, really important to and sometimes it's 30, and sometimes it's even the higher the progesterone, we're not seeing issues with high progesterone. High progesterone is usually an indication of good ovulation. That corpus luteum is after the egg bursts, and what's left over, the debris, if you will, is called corpus luteum. That's the thing that continues to produce progesterone. The higher it is, the better. And so it's usually a sign of good quality egg. It's usually a sign that, your hormones are healthy. And then, of course, we want to take a look at estrogen. And there's going to be a range for day 21 if you suspect to have high estrogen. So whether it's heavy periods, whether it's painful periods, maybe it's acne, maybe it's tenderness of the breasts, all that kind of stuff, we want to take a look at what might be causing that. And if estrogen is the culprit, then it's why estrogen, what's going on with the estrogen. So I hope you guys find it helpful to understand this kind of lab work. So you can save this, you can listen to this again, make sure that you write down, get your lab work either done, or make sure you get it from your doctor, and then listen to this again and make sure that you have all the tests that I recommend. So there's the day 3 LH, FSH, estrogen, and testosterone, including DHEA, including sex hormone binding globulin, all tested in the morning between 7 to 10 a.m. And then 7 days post ovulation, And that could be anywhere between day 19. So for some women, it's even day 30. And then that's a really long cycle. That's more of a 44-day cycle, but there's no right or wrong there. It's really figuring out when you're ovulating. And I think that that's a really good baseline. It's a really good basic lab work, if you will, if you're just trying to figure out where things are wrong. I'll tell you a really quick story. One of my patients, she sends me labs with her doctor, and it's like, hey, did you test these on day 3? And she's like, yeah. And I'm like, your FSH is extremely high. Like, there's no way you're ovulating. How long have you had this for? And she's just like, no idea how long she's had it for, and didn't realize that that was a problem, and that her hot flashes probably just meant that she was going into early menopause, as opposed to that's just hormonal imbalance. That was a really big awareness piece for her, to collect information, to have copies of that stuff, because she didn't have copies of that lab work until we started working together. And then to really understand, what does that mean? Like, getting your doctor to explain the results to you. And this is, again, why I have this podcast, because I want you guys to have this knowledge and awareness, so you're not blindsided by like, oh my God, I had no idea my FSH is supposed to be under 10 and it's actually 15, 17, or 30. And I'm trying to conceive and I'm not even ovulating. So wasting all my money on these LH strips or Mira or whatever other ways you're using to track hormones can get really confusing, where if we just run blood work, really basic lab work, you can get an idea of what's going on with your cycle. And then you learn how to track your cycle. It can be really, really empowering. So I do have all of those podcasts. If you guys need more resources, feel free to reach out on Instagram at Dr. Jane Levesque to help you understand what's actually, going on. And remember that lab work is just one way to look into the body. Tracking data is another. And then actually getting a proper health assessment and looking at your symptoms as well to help you connect the dots. So you're not just relying on blood work to tell you what's going on with your body. If you enjoyed this episode, please like it, share it, follow along so you don't miss any more useful information. And if you are looking for a practitioner to help you sort through your lab work, you've been struggling with infertility for a couple of years, and you just want somebody who's going to help you make sense of all the information that you have and follow through on a plan, then go ahead and fill out my application to Maximize Your Fertility program and see if I'm the right person to help you. Thanks so much for being here, you guys, and we'll see you next week.